Nobody moved. There were at least 11 people in that waiting area. Some standing, some seated on the padded chairs along the wall, and not one of them said anything when the woman at the reception desk told Martin Holt that he would need to reschedule. Not reschedule for a reason. Not reschedule because the doctor was running behind, or because there was a form missing, or because the system was down. Just reschedule. The way you'd say it to someone whose time didn't particularly matter. Martin had driven 2.5 hours to get to the Lakeview Specialty Clinic that morning. He'd left before 6, before the frost had come off the windshield properly, and he'd stopped once for coffee at a Tim Hortons outside of Barrie because the roads were slick and he didn't want to push it. He was wearing the same jacket he wore to everything, the dark green canvas one with the collar that didn't sit quite flat anymore, and he was carrying a manila folder with his documents in it, the kind of folder you'd find in any kitchen drawer in any house in Ontario. He was 53 years old, and he looked it. There was gray at his temples and in the stubble he hadn't bothered to shave that morning, and his hands, when he set the folder on the counter, were the hands of someone who had spent a long time doing work that left marks. The woman at the desk, her name tag said Sherry, didn't look up immediately. She finished whatever she was typing, took a breath, and then looked at Martin the way people look at something they're trying to determine belongs to them or not. "Do you have your referral number?" she asked. Martin gave it to her. She typed it in. She looked at the screen. She looked at Martin. "This referral is from a general practitioner in Sudbury," she said. "That's right. Our protocol is that referrals from outside the metro region go through the intake coordinator first. She's not in until Thursday." Martin was quiet for a moment. "The appointment was confirmed," he said. "I received a confirmation email 2 weeks ago." Sherry glanced at her screen again briefly, as if whatever was on it didn't require much consideration. The confirmation would have been sent automatically. It doesn't account for intake review. It had a date and a time on it. I understand that. She said it the way you say something when you don't want to keep explaining it. But we can't see you today without the intake coordinator signing off. If you'd like, I can put you on her call list for Thursday, and we can look at rebooking from there. From there, as if the conversation was already finished, already filed away, there was a man seated near the window, mid-40s, suit jacket, briefcase at his feet, who was watching. Not the way someone watches when they're going to say something, but the way they watch when they're glad it isn't them. A woman with a child on her lap had looked up from her phone, assessed the situation in a second, and looked back down. Everyone in that room had done the quiet math and decided it wasn't theirs to touch. Martin picked up the folder. He didn't argue. He didn't raise his voice. He said, "All right," and he stepped back from the counter. He found a chair near the far wall, sat down, and looked out the window at the parking lot. A light snow had started. It collected on the hoods of the cars the way it always did in November, thin and even, like something being carefully laid down. He sat there for 14 minutes. People came and went. Sherry processed 2 more patients in that time, both referred from local GPs. Both moved through without a question. Martin watched that. He watched it the way you watch something you want to understand fully before you decide what to do with it. Then he opened his folder, found the confirmation email he'd printed out, and looked at the bottom of the page. There was a patient services number. There was also, lower down, a governance and administration contact listed under the clinic's formal letterhead. The letterhead that identified the clinic not just as Lakeview Specialty Clinic, but as an operating unit of Northbrook Health Partners. Martin knew that name very well. He folded the paper along its original crease, returned it to the folder, and stood up. He walked back to the desk. "Excuse me," he said. Sherry looked up. "Could you tell me the name of the clinic director?" "The administrative director, not the medical." Something shifted in her expression, not quite irritation, but something adjacent to it. "Is there a specific concern I can help you with? I'd just like the name, please." She paused. "That would be Gerald Foss. But he's in a meeting until—" "Thank you," Martin said. He walked to the row of seats along the opposite wall, sat down again, and took out his phone. He didn't call anyone. He sent a text. It was 6 words. Then he put the phone back in his pocket and waited. The Northbrook Health Partners head office was on the 14th floor of a building on Bay Street in Toronto. Glass and steel, and the kind of lobby that made your footsteps sound purposeful whether you felt that way or not. Twice a year, the board of directors met there. Once a year, the annual financial review was presented to the shareholders committee. Martin Holt sat on that committee. He had, in fact, been the one to draft the governance charter that every operating unit of Northbrook Health Partners, including the Lakeview Specialty Clinic, was required to follow. The charter had a section on patient intake procedures. It was 7 pages long, and it said nothing about metro region restrictions on referrals. It said nothing about intake coordinators having override authority on confirmed appointments. What it did say, clearly, in language Martin had personally reviewed 3 times before it went to final draft, was that confirmed appointment notifications constituted binding scheduling commitments unless canceled by the patient or flagged for a documented clinical reason. He hadn't told anyone this yet. He sat in the waiting room of the Lakeview Specialty Clinic for another 22 minutes, watching the desk. At 9:47, a door near the back opened and a man came through it, moving quickly. Late 50s, reading glasses pushed up on his forehead, the particular energy of someone who has just been told something unexpected. He scanned the waiting room and found Martin and came directly over. "Mr. Holt," he said. "I'm Gerald Foss. I'm the administrative director here." He extended his hand. "I want to apologize. There's been a significant misunderstanding this morning, and I want to address it personally." Martin shook his hand. "I appreciate that. If you'll come with me, we'll get this sorted right away. We have a room available, and Dr. Mira Okafor is ready whenever you are." Martin stood, picked up his folder, and followed Gerald through the door at the back. He didn't look at the front desk as he passed it. The consultation room was small and clean, the kind of room that smells like nothing in particular, which is its own kind of smell. Dr. Mira Okafor was already in it when Martin arrived. She was younger than he expected, early 40s, with the direct, efficient manner of someone who had long since stopped performing warmth and settled into just being genuinely attentive, which was better. She introduced herself and they sat down, and she went through the file his GP in Sudbury had sent over. "You've been dealing with this for about 18 months, she said. "It wasn't a question." "About that," Martin said, "and your GP flagged the nerve involvement as the primary concern." "He did." She looked up from the file. "He was right to." She said it the way people say things when they're not trying to soften them, just make them accurate. Martin found that he appreciated this more than he would have appreciated the alternative. They went through the case methodically. The initial symptoms, the progression, the 2 rounds of tests that had produced results that were clear enough to cause concern, but not clear enough to produce a diagnosis without specialist input. Mira asked good questions. Martin answered them as precisely as he could. When he wasn't sure of something, he said so, and she wrote it down the same way she wrote down everything else, without inflection. At one point she asked, "How long did you wait this morning before someone reached out to you?" Martin looked at her. 36 minutes. She wrote that down too. When the consultation was done, it took just over an hour. She walked Martin to the door of the consultation room and shook his hand. "I'll have a preliminary report to your GP within 2 weeks, she said, "and I'll flag it for expedited review given the timeline we've been dealing with." "Thank you," Martin said. She held the door. "I'm sorry about this morning," she said, "not just about the delay, about the way it was handled." Martin looked at her for a moment. "I know you didn't have anything to do with it." "No," she said, "but it happened in a building I work in." He thought about that on the drive home. Martin Holt was not a man who talked about money. He had grown up in a house in Timmins, where talking about money was the same as talking about the weather. It was always there. It was often difficult, and there was usually nothing much to be done about it except put your head down and work. His father had been a machinist. His mother had worked at the credit union for 26 years. Both of them had understood, in the practical, unspectacular way of people who live close to the margin, that what you had didn't make you who you were. Martin had kept that. He had also, over the course of 3 decades, built something that would have been difficult for his father to comprehend in scale, though not in principle. Northbrook Health Partners had started as a single-site clinic in Sault-Ste. Marie, a converted storefront on a street where the nearest alternative was a 2-hour drive. Martin had done the renovation himself, with 2 other people and a set of second-hand tools. The clinic had operated at a loss for 14 months before it turned a corner. That was 1997. By 2008, Northbrook had 6 sites across northern Ontario. By 2015, it had 22, including 3 in rural Quebec and 1 in northern Manitoba. By the time the board had expanded to include outside investors and the organization had formally incorporated as Northbrook Health Partners, Martin had stepped back from day-to-day operations. He still attended board meetings. He still reviewed governance documents. He was still, in the ways that mattered legally and structurally, the foundational shareholder. He didn't talk about this. He drove a truck that was 8 years old and needed new wiper blades. He had a house outside of Sudbury on 2 acres of mixed forest that he'd bought in 2003 and never substantially renovated. He had 1 child, a daughter, Nora, who was 27 and lived in Vancouver and called him every Sunday at 7 p.m., which he looked forward to without ever saying so. He wore the green canvas jacket to everything, including, once, a board meeting, which had caused a brief, silent disruption that he had not acknowledged. People saw what they saw. On the drive back from Lakeview, he stopped at the same Tim Hortons outside Barrie. The roads were still slick. He sat at a table by the window with a coffee and a biscuit and watched the highway traffic move past in the gray November light. His phone rang. He looked at the screen. It was his contact at the board, a woman named Patricia Yoon, who handled governance oversight for the Eastern Division. "I got your text," she said. "I know. Can you walk me through what happened?" Martin walked her through it. He was precise about the sequence. He didn't editorialize. When he finished, Patricia was quiet for a moment. "The intake coordinator override policy, that's not in the charter." "No," Martin said. "It's not. Where did it come from?" "I don't know yet. That's what I'd like to find out." Another pause. "You want me to open a formal review? I want you to open a review. Not just for this site. For all sites in the Eastern Division, patient intake confirmation protocols, whether they're being followed, whether there are local policies that contradict the charter. That's going to take some time." "I know," Martin said. "Take the time." Patricia said she would. They said goodbye. Martin finished his coffee. Outside, the highway traffic kept moving, steady and indifferent, and the snow was coming down a little harder now. The formal review took 11 weeks. What it found was not unusual, exactly. It was the kind of thing that happens in large organizations when the original intent gets translated and retranslated through layers of administration until it no longer quite resembles itself. The Lakeview Clinic had implemented the intake coordinator requirement 18 months earlier, introduced by the site manager at the time as a quality control measure. The site manager had since moved to a different position. The policy had stayed. Nobody had checked it against the charter. Nobody had asked whether it was creating barriers for patients coming from outside the metro region, which, in northern Ontario, was most patients. It had been, in a quiet and unintentional way, a policy that sorted people. Patients with local referrals got through. Patients without them waited. The review flagged 4 other sites with similar issues. All of them had grown from local workarounds that had hardened, over time, into unofficial rules. Patricia presented the findings to the board in February. Martin attended by phone. He was in Sudbury that week and didn't see the need to travel, and listened to the summary while standing in his kitchen, looking out at the trees in the backyard, which were bare and gray-white and looked, in the early morning light, like something drawn in pencil. When Patricia finished, the board chair asked if there were any initial responses. Martin said, "I'd like to propose a patient access audit, standing, quarterly, for all sites. Intake procedures, confirmation protocols, regional referral equivalents. I want it built into the governance calendar." The motion passed. Martin set his phone down on the counter and poured a second cup of coffee. He thought about the waiting room at Lakeview. He thought about the 11 people who hadn't said anything. He thought about the man by the window with the briefcase, who had done the math and decided it wasn't his problem. Martin understood that impulse. He had never held it against anyone. But he thought about the people who had come through that waiting room before him, the ones who hadn't had a folder with a governance contact on the last page, the ones who had just rescheduled, as instructed, and gone home, and waited again, and said nothing because they didn't know there was anything to say. He thought about those people for a long time. In March, Martin drove back to Lakeview. He had a follow-up appointment with Mira. The preliminary report had indicated what everyone had expected it to indicate, and the follow-up was procedural, a next step in what was going to be a measured and ongoing process. He was fine with that. He had learned over 53 years that most things were measured and ongoing, and that the ones worth dealing with required patience more than urgency. He arrived a few minutes before 9. The waiting room had been repainted, a small thing but noticeable. The chairs along the wall had been replaced with something slightly more substantial. There was a printed notice on the front desk, visible from the entrance, that listed the patient rights and intake procedures in plain language. It had been drafted as part of the post-review materials and was now required at all Northbrook sites. The reception desk was staffed by someone he didn't recognize, a younger man, mid-20s, who looked up when Martin came in and said, "Good morning. Can I get your name?" Martin told him. The young man typed it in and looked at his screen. "You're here for Dr. Okafor at 9:15. You're a little early. She's just finishing up with another patient. Can I get you to have a seat?" "Of course," Martin said. He sat in one of the new chairs near the window. Outside, the parking lot was clear. The last of the winter frost had come off weeks ago, and the trees at the edge of the lot were starting to show the particular pale green of early spring, tentative and precise, the way things in Ontario come back when they finally come back. A woman 2 seats over was reading something on her phone. A teenage boy near the door had headphones in and was looking at the floor. An older man across the room met Martin's eye briefly, nodded, looked away. The room was quiet and ordinary and doing exactly what it was supposed to do. Gerald came through the door at the back at 9:05, moving with the same quick energy as the last time, though the reading glasses were down on his face now rather than pushed up on his forehead. He saw Martin and came over. "Mr. Holt," he said. "Good to see you again." He paused. "I want you to know, the staff review, the intake changes, the notice posting, we've implemented everything in the report, all of it." "I know," Martin said. "I saw the compliance summary." Gerald looked at him for a moment. There was something in his expression that wasn't quite uncertainty, and wasn't quite embarrassment. It was the specific look of a person who is recalibrating, trying to redraw a map that turned out to be wrong in a way they should probably have noticed earlier. "I've been in health administration for 20 years, Gerald said. "I don't think I've ever had a patient follow-up on something like this." Martin considered that. "I grew up in Timmins," he said. "The nearest specialist was in Sudbury. If your referral didn't go through on the first try, you waited. Not because the system required it, just because nobody had built a better version yet." Gerald was quiet. "Most people here," Martin continued, "they're not coming from downtown Toronto. They're coming from somewhere with one road in and one road out, and they've already rearranged their week to make the drive. That should be the starting point, not the obstacle course." Gerald nodded. It was the slow nods of someone who is actually listening rather than waiting for an opening to respond. "We're going to get it right," Gerald said. "Or closer to right than we were." "That's all I'm asking," Martin said. The door opened and Mira leaned out. "Mr. Holt, ready for you." Martin stood, picked up his folder, the same manila one, slightly more worn now at the corners, and followed her back into the consultation room. He didn't look different than he had in November. Same jacket, same hands. The gray at his temples had spread a little, maybe the March light just showed it more clearly. He sat down across from Mira, and she opened the file and they got to work. Outside, through the narrow window at the end of the hallway, the parking lot was bright and flat and ordinary, and the trees at the edge of it held their new green carefully, the way things do when they know the cold isn't entirely finished yet, but they've decided to start anyway.